special guests that we're so privileged to have here at the Health Sciences Centre today. Honourable Sylvia Jones, Deputy Minister and Minister of Health. Thank you so much for being with us today. MPP Kevin Holland. And also our special guest, we have the Mayor, Ken Boshkoff. I saw Ken somewhere. There you are. I'm looking out there and there you are. Thank you, Ken. So before we get started, I wanted to take the opportunity to acknowledge the land which we are on today. Thunder Bay Regional Health Sciences Centre respectfully acknowledges we are located on the traditional lands of the Indigenous peoples of the traditional lands of Fort William First Nation, signatory to the Robinson Superior Treaty of 1850. We acknowledge the history that many nations hold in our region, and we are committed to the relationship with First Nations, Métis, and Inuit peoples based on the principles of mutual trust, respect, reciprocity, and collaboration in the spirit of reconciliation. Thank you so much for being with us today. We had a wonderful opportunity earlier this morning to showcase our Health Sciences Centre for the Honourable Health Minister and for MPP Holland. So it was a wonderful opportunity to showcase the wonderful and unique things that we have within our Health Sciences Centre to better serve the needs across Northwestern Ontario. So thank you so much for working with us this morning. We had the opportunity as well to highlight the needs of the North, and we certainly know that, and we recognize the significant challenges we face in Northwestern Ontario, and we are very excited that we have an opportunity to improve the health status of the patients that we serve across Northwestern Ontario. We are working very hard to ensure that our vision of exceptional care for every patient, every time, is experienced by everyone accessing care here at the Health Sciences Centre. MPP Holland has been incredibly instrumental. I wanted to thank you, MPP Holland, for gaining support and advocating very strongly for our community and really helping us to work and move forward with our mission and our vision across the Health Sciences Centre. Now I want to take the opportunity to welcome MPP Holland. He has some remarks, and I will turn it over to you.
Thank you, Rhonda, for the acknowledgement of the land and for your kind introduction. Good morning, everybody. It's really great to see everybody come out today, and I want to thank you for joining us here. Well, a special thank you to Minister Jones and Deputy Premier for joining us here in Thunder Bay, and you have the distinct privilege of being number 44 to Thunder Bay. So she's our 44th minister's visit to Thunder Bay, and I think that's a real testament to our government's commitment to Northern Ontario and Thunder Bay in particular. So I'd also like to acknowledge and give a call out to His Worship Ken Boshkoff and thank him for his support and partnership in building the Thunder Bay region. We have a tremendous working relationship, and I think that is so vital for us to work together to advance the interests of our region. We're gathered here today to announce a significant milestone in the ongoing journey to improving healthcare services in our community. Our government's investment this year of over $1.18 billion in healthcare across the province is a testament to our dedication to expanding accessible, high-quality care for all Ontarians. And I'm thrilled to highlight that a significant portion of this investment is coming to Thunder Bay, funding 34 much-needed beds. The Thunder Bay Regional Health Sciences Centre is renowned for its commitment, innovation, and research. And with this investment, we are further solidifying our status as a hub for cutting-edge healthcare in Northwestern Ontario. Our community will continue to benefit from the latest medical advancements, and our hospital will remain a centre of excellence in healthcare delivery. This transformative funding allocation marks a pivotal moment for Thunder Bay's healthcare landscape. It represents not just an investment in infrastructure, but moreover a crucial investment to the well-being of our communities. It's a substantial leap forward, enabling a wider capacity of support and undoubtedly ushering in a new era of enhanced healthcare services, promising a brighter and healthier future for our region. It is a necessary and tangible step towards building a healthcare system that better serves patients today and for generations to come. In closing, this momentous investment in the Thunder Bay District's healthcare system is yet another example of our government's promise that we will continue doing the work necessary to promote access to healthcare when and where our residents need it most. Together, we can look forward to a future where quality healthcare is a cornerstone of our region where families can find solace in knowing that their loved ones will receive the best care possible right here at home. Thank you to the entire team of the Thunder Bay Regional Health Sciences Centre for their commitment to excellence and quality care, and may this investment lead to a healthier and brighter future for all of us. Thank you.
So, Kevin, if this is the 44th visit of a cabinet minister, do I get included when I visited Thunder Bay as the Solicitor General?
Well, I wasn't elected yet. I'm talking since I've been elected. So.
Thank you, MPP Holland, and good morning, everyone. Can I just start by thanking Rhonda and your team? You know, the time that your team took this morning to show MPP Holland and I some of the highlights, some of the challenges, and some of the opportunities that are here and that you've been working on really helps drive home for me that today's investment is going in the right place. So thank you for that. It is great to be here again in Thunder Bay alongside my friend and colleague, MPP Kevin Holland. Kevin, of course, is a champion for his community at Queen's Park and a tremendous supporter of building a more connected and convenient healthcare system here in Thunder Bay, Atikokan, and across the province. And I know he has partners like Mayor Boschkoff, who is standing right there with us, understanding and appreciating where the investments need to be and will happen. You know, for too long, communities like Thunder Bay have been ignored. But with champions like MPP Holland and Premier Ford, communities across Ontario are seeing healthcare investments in people, programs, and capital. I want to thank Dr. Rhonda Crocker-Ellicott and the entire team at Thunder Bay Regional Health Sciences for their time today and for the work that they do every day for all the healthcare workers across Thunder Bay and Northwestern Ontario, and for everything you do to provide exceptional care to patients and families every day. I saw it as I was touring some of your departments. I see the passion in your leadership, and I see it in your teams. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Through the Your Health Plan, our government is building a healthcare system that puts people at its heart, making it easier to connect to care closer to home, improving the healthcare experience for all Ontarians for years to come. This includes continuing to make critical investments in our hospitals and healthcare infrastructure to ensure patients will continue to have convenient access to high-quality care in their community. Today, I am very pleased to announce that our government is investing up to $7.8 million Thunder Bay Regional Health Sciences Centre to continue to support alternative level of care transitional beds and acute mental health beds. This is part of our government's investment of nearly $1.2 billion this year to continue to support over 3,500 hospital beds across Ontario. This investment is yet another step our government is taking to improve access, expand capacity, and decrease wait times to build a healthcare system that better serves patients both now and into the future. Since 2018, our government has increased our investment in healthcare by over $16 billion. We are getting shovels in the ground for over 50 new hospital developments that will add more than 3,000 new hospital beds in communities across Ontario over the next 10 years. We're growing our healthcare workforce through the largest medical school expansion in Ontario's history, adding undergraduate and residency positions at every medical school in the province, including, of course, at the Northern Ontario School of Medicine. And we are bringing more healthcare workers to northern and rural communities through programs like the Learn and Stay grant. That provides upfront programming for tuition and other education costs like books for nursing, lab techs, and paramedic students in exchange for a term of service in areas of highest need like Thunder Bay. And we're continuing to make it easier for patients to connect to the care they need, when they need it, right here in the Thunder Bay region. We are investing in the development of a comprehensive cardiovascular surgery program at Thunder Bay Regional Health Sciences Centre. And we continue to provide increased operational funding and health infrastructure renewal funding to the Thunder Bay Regional Health Sciences Centre. Our government will continue to work with our local healthcare partners to ensure communities have the hospital capacity and healthcare services they need to provide more convenient, patient-focused healthcare here in Thunder Bay and across Ontario. Thank you. Stay well.
Thank you so much, Health Minister. Thank you, Sylvia. Thank you so much for this announcement, for this investment in our community. Thank you so much, MPP Holland. Thank you, everyone. This is an incredible announcement for Thunder Bay Regional Health Sciences Centre. This really supports our permanent capacity to really support the needs of patients and families across northwestern Ontario. So we're very thankful of the investment and support that we're receiving from this government in support of exceptional care for every patient every time here at the Health Sciences Centre. So thank you all, and our speakers are available for media interview. Thank you.
Michelle Allen, CBC Thunder Bay. My question is, as pharmacists are getting expanded coverage through OHIP for services, is the province considering leveraging NPs to deliver OHIP insurance services?
Yeah, you are referencing the fact that we have now expanded scope of practice for pharmacists to allow them to treat minor ailments. So it could be cold sores, it could be nausea during pregnancy. We started in January with that scope of practice increase of 13 minor ailments, and we've seen amazing uptake. Over 400,000 individuals have accessed those services through the pharmacy. What does that really mean? It means that they've had another pathway other than the emergency department, other than a primary care or community health care center. In terms of expanding scope of practice for other medical practitioners, absolutely. We have done some work in the nurse practitioner space. We're working with the College of Nurses to do the same. We want to make sure that people and clinicians are practicing to their highest level, because we know that people expect to be able to have those conversations with their healthcare practitioner regardless of who they are. So yes, we are.
Can you be specific about what that is in those conversations with the Nurses College? So like, what do you plan to do?
So it's a bit of a two-way conversation. We need to have the conversations with the regulatory college to make sure that the individuals and the clinicians have the interest and the knowledge, education to do it. So it is a back and forth of what the colleges and regulatory colleges want to see as expanded scope of practice, and then we take that back within the ministry, have those conversations, and make the changes. We do it in a very strategic way so that we are making sure that the patients understand where those additional pathways are. That's why with, as examples, the pharmacy scope of practice, we did one in January, and of course we did one in October. So we will work with the colleges to make sure that the scope of practice is needed, is necessary, that the college and the clinicians are ready for that change, and then we will make those announcements publicly.
Thanks for taking the question. Obviously, NOSM is going to provide quite a bit of support in the future in terms of addressing the doctor shortage in the north. We know that's still quite a far ways off. We know tens of thousands in this community are without a primary care provider. Even worse across the region, what role does the provincial government play in addressing that issue?
Well, it's frankly one of the reasons, and we talked about it earlier today. I'm very excited about our government's expansion of primary care access. So in the spring, we sent out an expression of interest to communities and organizations who wanted to see primary care expansions. We had an amazing turnout in terms of interest, and we are now making assessments on that. So our government has made a commitment to expand primary care access. Again, could be through community health clinics, nurse practitioner-led clinics, or of course family practitioners. That expansion of that multidisciplinary approach is basically the largest expansion that we've had since we started multidisciplinary teams in Ontario. And we will start to see those announcements coming out in the coming months.
Okay, and maybe shifting a tiny bit, this is so related to health, obviously. We had a community safety meeting, some local leaders attended, talked about some of the big issues we're having in our city in terms of crime rates. A lot of it led to opioids, homelessness, violence along those lines. Someone from one of the homeless outreach groups was saying they had to help, I think it was 3 times as many people living outdoors this summer. As we transition into the winter, that's very devastating for a lot of the groups that are offering shelter bed, and they're finding they don't have enough capacity and they're not even close to being able to help the amount of people that are going to need these services. And this is dragging on, but really quickly to wrap it up, some local politicians have said this is something in terms of our IGA that has been reaching out to the provincial government. What do those talks look like, and is there any help coming?
So without a doubt, we have seen an increase in opioid use and abuse in all of our communities, particularly in Northern Ontario, but certainly not exclusively too. As we were chatting with the emergency department staff, saw what impact that has on emergency departments. Look, this is an all-of-government approach, right? We need the federal government to make sure that they are cracking down on the illegal drugs coming in. We need a provincial government that continues to invest in mental health and addictions. You know, I'm proud of the fact that since 2018, our government has seen a 25% increase in funds and investments in youth mental health and addictions, whether it's through youth wellness hubs, whether it's through the expansion of treatment beds, all of those pieces together. And yes, there is absolutely a municipal component, but we cannot have people pointing fingers and saying it's someone else's problem. This is a societal problem that we are going to have to deal with multi-jurisdictionally and multi-government wise. Otherwise, frankly, those issues, those problems, those concerns end up in our emergency department rooms.
Marcus at CBC. This is for all of here. So physicians and healthcare stakeholders in Red Lake community just west of us said they still haven't received a detailed explanation of why the physician claimed it was back in July. When do you plan on getting them this information?
So I want to be clear, these agreements are agreements made with the Physician Services Agreement and the Ontario Medical Association, and there is no cut that is happening in Red Lake or Atikokan. I met with the Atikokan municipal representatives at the Association of Municipalities of Ontario. I assured them and reassured them that as they are able to recruit additional primary care practitioners, we as a government will be there to support them. There is no change to the existing component. There will be no layoffs of existing physicians in these communities.
CJ Gilder, Acadia Broadcasting. Just a quick question for you. So there's a good amount of funding coming here to Thunder Bay, but there's also other units throughout the region, say Dryden and Fort Francis. What sort of funding or counts like that going to see?
So the programs that we often talk about, whether it is a Learn and Stay program that I referenced in my comments about training lab technicians, paramedics, and nurses. So we pay for their tuition and their books. In exchange, they will continue to serve in a community of greatest need for as much as 2 to 4 years. Those are programs that are available all across the north and have been very strong uptake of them. The programs that we've put in place specifically to assist on the emergency department, whether it is dedicated offload nursing individuals who could be a respiratory technician, a pharmacist, or a nurse who is paid directly 100% by the province to take on, assess, so that paramedics can go back out onto the streets and continue their work in community. There are so many programs, and it was actually one of the things we were talking about earlier this morning, where I wanted feedback on which ones which programs has the government put in place in the last 2 to 3 years is Thunder Bay using most effectively. So that feedback really drives our decisions on where additional investments can happen. And it was wonderful to see that many of the programs, whether it was emergency department peer-in-peer, where we have a newer emergency department physician who is matched with a longer-term seasoned emergency department physician, has that opportunity to consult, even if they're not in the same community or in the same emergency department. Nurse preceptor programs, again, where you were matching a very seasoned nurse with a new nursing student who wants to get that first-hand experience in hospital, in long-term care. All of those programs together, and we allow hospitals to choose which ones best suit their needs, are making a difference in the retention and recruitment piece that is so critical to our health human resources.
Thank you very much.
Thanks for your time.